Our Food for Thought events were created to connect, learn, and explore with our stakeholders. And it's mostly topics, of course, that are related to our issues that matter. And we're so grateful for all of you joining us today.
So health equity, everyone should have an equal opportunity to live the healthiest life possible. I think we can all agree that that's something we want. I think we have to really understand that there are some obstacles out there that people face that prevent that from happening. Poverty, discrimination being two of them. With health equity, we want to ensure access to a quality education, safe housing, safe environments where people can get out and exercise and get healthy, and high quality health care and high quality healthy food. Those are all components of health, and not everybody has the same level of access to those things. Part of this is identifying those groups that are less healthy than the rest of us, figuring out why, and then doing something about it. And that's really the important part. According to the Broward County Health Assessment, that looks at the overall health of our residents here in Broward, when we look at the rate of heart disease, stroke, diabetes, high blood pressure, they're all worse here than the state average. And we've been involved in health, community health, for a long, long time. And it's an issue that matters. It's one of our 10 issues that matter. In fact, we've called it Be Fit. And the goal is to empower people to take control of their health, to remove those barriers that stand in their way, and give them every opportunity to be the healthiest they can be. So I'm excited to share that there is a new phase of what we're doing with Be Fit, and you're going to be very excited about it. And it's happening. It's a collaborative approach that's happening in the south end of our county, in South Broward. It's a pilot program with the Urban Health Partnership. And when we look at South Broward, there are several cities down there that are determined to be food deserts. In other words, there's not a supermarket nearby. You don't have large nonprofit capacity there helping these folks in that community. You have a lot of smaller organizations like your churches. So our effort is an effort to build a collaboration, to build what we call the South Broward Community Health Hub. We're stronger when we work together, and really it leverages what we do best here at the foundation, bring resources together and bring philanthropists together to make this happen and really change the lives of tens of thousands of residents right here in Broward County.
Health is only going to be there if there's wealth. If there's no wealth, there's no health. So we have to get folks economically stable and make sure that they have adequate income to have a healthy life for themselves and their family. But in my world, working with population health, where you live matters how long you live. So if you can, this happens to be a map of some areas in Miami-Dade County, and there's a map just like this for Broward County. And if you look at the one, you can see where it says 71 years, you can see it points to Overtown. And on Biscayne Drive, Biscayne Boulevard, people are living to 86 years. So within 5 miles, the distance is within 5 miles, the life expectancy is 15 years different. And this is something that really speaks to disparities and inequities. And unfortunately, it's all the time too much in minority neighborhoods. When does it come to making improvements was the question that was put before me to have folks live better. Well, one of the things we want to do is make sure that our Black nonprofits and our Black-led education organizations in the community, that those organizations have an ongoing commitment to getting Black leadership at a high level. Diversity, equity, and inclusiveness. And these 3 words mean that we are going to make sure we reduce disparities in how we provide these services, whether they're in a hospital or at a police force or wherever they may be. We want to create that sense of equity.
Okay, so we had 3 groups in terms of the effects of health disparities on race. We talked about food access, we talked about environmental barriers, and we talked about healthcare access.
That we are the biggest producer of essentially the healthiest foods in Florida here, but we don't keep it here in Florida because it's big business, so we export it away. So maybe we should keep a little bit more here, and it would be better for our residents here in Broward.
Affordable housing was the first thing that we talked about. People who spend a disproportionate amount of their income on affordable housing or on housing insecure, also have a much higher risk of cardiovascular disease. Eyesight screenings for children, they do those in school. They can screen the children. They find out they have deficiencies, but nobody was putting glasses on the kids' faces then. Right. And then what does that mean for their ability to learn and see in the classroom and participate? And also school gardens, where kids can actually garden at school. They may save vegetables they've never seen before. Parents have never cooked at home, and they cook with them and they can take them home with them, which is also really neat.
Memorial is really going into the communities to build trust. That's a huge barrier to accessing healthcare. And Melita pointed out, if they don't have trust in the healthcare, they'll never access it.
I would like to say thank you on behalf of the board and the staff for supporting the Community Foundation and making us a part of your life. We appreciate it. And I hope that you stay healthy and safe during the holidays and you get to enjoy a little bit of joy, but stay safe most of all.